what's the most critical skill gap you've seen in home health care or even in nursing in general that your CNA
Mhm.
program specifically addresses for families caring for loved ones?
Well, so I have the golden opportunity to train people from all walks of life as young as 17. And I think my oldest student recently was 72.
Oh,
Okay.
wow.
Oh, yeah. Yeah. Here in Colorado, you know, I've worked in 5 different states. Okay. As I said, I came from New York, went to LA, went out to Maryland. And of course, when you live in Maryland, you got that whole Virginia, West Virginia,
Yep.
Washington, D.C., that whole arena that I worked in. Okay. And I was in Baltimore and LA. So, and then I came out here. And so the thing that I noticed is that out here in Colorado, you have such wonderful programs for families taking care of the family. See, a lot of the other states in my past didn't have this option.
Oh, I see.
So the people that I'm training to be CNAs, some of them are young people. They're coming out of high school. They want to become a nurse, or they want to become a therapist, or they want to become a doctor. So they take my program because it's quick. Okay. And because they can start making a little bit better money while they're continuing their education. But there's a good portion of the students that come to me, both in Colorado Springs and Pueblo, that maybe they have a disabled child or maybe an elderly parent that needs care. You know, when I started, if you were old and sick, you got sent to a nursing home. That's
Right.
not our goal anymore. Our goal is let's keep mom and dad home. Let's keep grandma and grandpa at home. And let's learn how to take care of them safely so that they get the best care, but also so your caregiver doesn't get hurt. Because injuries among nurses and nurses' aides, when I first started, frequent. I'm
Right.
trying to change that. I'm trying to change them and try to teach them so that, you know what, they can do everything they need to do with the equipment they need, with the timelines they did. And in the state of Colorado, there are programs where they can get paid so that it's not a choice between do I take care of mom or do I have a job?
Right. Right. And I know not only is it the goal to kind of keep the family together and, not going to a home,
Mhm.
it's extremely expensive to
Oh,
put anybody in a home. And they
mhm,
may or may not have better care there, or it may be easier, but
mhm,
people can't afford it. And so it becomes, they move in, say it's an elderly, or their
mhm,
parent or something, they move in, and
mhm,
now depending on what their illness is, whether they need constant care and watching, or
mhm,
if they just need to make sure somebody's in the house with them. But
mhm.
it's also, the compassion and how we handle when a medical issue happens or a lifestyle medical issue happens.
Correct.
And then also, what do we do? Because a lot of people, then if it's someone who needs constant care,
Mhm.
then they can't have their job outside of the home.
Correct.
And they also need help because when you're a caregiver, you also get burnt out, and especially
Yeah.
if that is not your profession.
Right. And and the thing is, some of the CNAs will go work in the acute care scenes, your hospitals. Some of them will go to rehab. Some of them will go to skilled nursing. Some will go work in assisted living. There's see that's the nice thing about being a CNA. I tell my students, the CNA door is the door to 1,000 more.
Okay.
Because once you have that golden ticket in your hand, the only limit that's on you is what you put on you. Okay.
Okay.
There are opportunities everywhere. How many times have you gone to make an appointment with your doctor and you're sick right now and they say, well, we can see you in a month from now.
Right.
That's
Yep.
the reality right now.
Yes.
Okay. So when I train people to be CNAs, I will never train them to just be a CNA. And that my students all know that's not a good term with me.
Okay.
I train you to be the face piece of the healthcare scene because most patients could care less about the RN or the LPN. You know who they want to see? They want to see the nursing assistant. Why? Because you've put hands on them, you've shown them the love, You have listened to their stories. That's what we need. We need people who want to hear people, who want to help. And
Right.
my program is uniquely structured that, so I have a background in geriatric nursing. I also have a background in pediatric nursing.
Oh
I've
wow,
worked
you
for
go with
acute
a
care
full
hospital.
spectrum.
I really have. I've worked ICU, I've worked ER, I've worked med surge, I've worked home health, I've gone to research. I've had a beautiful, beautiful career. So when, let's say you, Sandy, you come to me and you say, I want to be a CNA. Well, in the time that I'm training you, I'm watching you. And come graduation, I'm going to say something to you. And I'm going to say something like, Sandy, I noticed you're a natural born leader. You're going to take this CNA, you're going to become the lead CNA wherever you go work. And then after you've done that for a year or two, you're going to continue on, whether it's going into more nursing or you're going into radiology or you going, the future is all yours. And I recently was told by a former graduate of mine that she just recently was accepted to pre-med
Oh
and
wow.
she is going to be a physician. I was so
Wow.
excited because when she came into my classroom, the first thing she said to me is, well, I don't know if I'm smart enough to do this because, well, I was never a real good student. And I said, like, okay, leave those doors, those words at the door. That doesn't live in my classroom.
I love it.
Okay. So getting that phone call from her, you can imagine I'm riding a cloud on it.
Yes, you're beaming. So not only are you cultivating the healthcare aspect of it, but you are also cultivating the person that they are that maybe they didn't know they were. It seems like you
Mhm.
can spot the different things in these people, and sometimes we just need somebody to see us and to
Mhm.
see something in us that we don't,
Mhm.
and we can make a huge difference in our community, in the world, because Ellen saw something in me.
Right. And it's funny because, I've got students from 4 or 5 years ago. Every now and then I get a phone call. I got one this morning and she calls me mama. And because she said I reminded her of her grandma. Okay, I'll take that.
Right.
But they just needed someone to believe in them. And
Yes.
this CNA program believes in its students. And they actually get my personal cell number to reach me because if we're going to see you through it, you got to be able to find me,
Right.
not leave a voice message and not hear from me from a week. I don't believe in that.
Right. Yeah, when they need you, they probably know that, yes, you can call and say hi, that's perfectly fine, but
Mm-hmm.
if you need me, use this, because when that call comes in, I know that you're having an issue, you have a
Mm-hmm.
question, something, and I'm going to answer it if I can. And if I can't, I will answer it as soon as possible. I'll call you back.
Correct. Correct. And they all the students know that. And, and it, I feel like I'm hoping that they're getting as much out of it as I get. I mean, I tell them they energize me every time I'm in class. They really do.
Yeah. And I think that's a little bit different than, and I don't know because I haven't been in any of the programs, but healthcare workers in general, I believe, are heart centered. I mean, they're not getting into
Mm-hmm.
it for, to become rich. I don't care what it is.
Well, you
I
can
mean,
try, you can make money, but do
yeah,
you want to spend 8 hours being miserable just for a paycheck?
right,
That's one of the things I ask the students. When you go look for a job, use your five senses. What does the place look like? Are you hearing the call bells not getting answered? What does it smell like? When you walk in the door, does it smell pleasant like flowers or something else? Okay. What are people talking to each other? How are they being? Are the team members, do they like each other? You know, you've got to love what you're doing and you got to love where you are. And remember, I told all my CNAs, you are the golden nugget everybody wants.
right. And if being a CNA, it is, you can make it what you want to,
Mhm.
but the general CNA um, certification, all that, that is both physical work and
Oh, yes,
emotional. So
absolutely.
so this isn't something, again, you can be a CNA and step back from some of the physical work. I don't know how that 75-year-old, if she was very physical and could do things, maybe she was very spry. But if there were certain limitations, that doesn't mean you can't take the program and you can't be a CNA. It just means you've got to go ahead and prioritize, or figure out.
Well, the program does have requirements, as does the state. You have to be able to pick up, push, pull at least 50 pounds. You need to be able to bend down and get back up. I mean, so there are some requirements. Okay. But as I said, the seniors that I've had coming back, they're sometimes they're surpassing the younger ones. So there are some people that know this will not be the path for them. And if you came to me and you said, "Hey, Ellen, I'd like to talk about becoming a CNA," we have dialogue way before I ever hand you that application. Because what I don't want to do is I don't want to give you false hope on something, but maybe I can give you some other ideas of other things to look at. The person that I was telling you in their 70s actually was becoming a CNA for a grandchild.
Right. That's what I
Grandchild
was.
had autism.
Yeah.
Yeah, grandchild had autism. And so she was going to have this child anyway. And she was having to do tube feedings and she was having to do a lot of things. So for her, she was going to be taking care of this child anyway. But she needed to know how to do it and how to do it safely for both of them.
Right. And that's kind of what I was thinking is there are different paths to this, and the certification is a certification, and your reason why could be different. And I didn't want to, I mean, obviously you're going to talk to them and see if it's right for them. It are a bunch of people who want to go into the healthcare industry. There are a bunch of people who their life changed because of a family member in some way, or
Mm-hmm.
a loved one in some way. And exactly what you said, so she had to meet the minimum requirements, but
Correct.
her long-term goal wasn't to use that in a setting where she was going to have to be lifting and pulling. I mean, with the grandchild,
Right.
obviously, depending on how disabled.
Mm-hmm.
So I don't want people to think, oh, I can't do it, because yes, you have to meet the minimum requirement for this
Mm-hmm.
certification, but that doesn't mean that's the life you're having afterwards. If you want to be a home health aide, although you can do that without any certification, you can get a,
Actually,
um,
for home health aide, you should be CNA as well.
okay,
And the thing is, the certification that you get, whether you go to my program or any other program, that is the key, like I said, to 1,000 doors. You can take that CNA, you can apply to DME, durable medical equipment. You can apply to acute care hospitals. You can use that in any place. And that's why the baseline of the CNA program, you have to be able to meet that criteria. I don't very often have to turn people away. I think let's see, I've got this program open 4.5 years now. And I think I've only ever really turned one person away. And that was because she was actually losing her vision. And while it wasn't a discriminatory thing, it was a reality. She needed to get that vision fixed.
right.
And then if she wanted, she could come back. I've not heard from her that she wanted to come back, but luckily she did get some corrective surgery. So we'll see what's going to happen with that.